From the studios of the Department of Communication in Phillipsburg, welcome to Prime Minister Talks with Honorable Prime Minister Silveria Jacobs.
Hello and welcome to Season 2, Episode 8 of Prime Minister Talks. I am Silveria Jacobs, your Prime Minister, and with me I have a very exciting guest. He has been on St. Martin recently, is a well-known and respected professional in the field of epidemiology, and I am proud to have as our guest today, Dr. Duits. So Dr. Duits, welcome to the program, and would you be so kind as to briefly introduce yourself to our listening and viewing audience, as well as give us a little bit about your professional background?
Okay, thanks again, Prime Minister. Thanks for the opportunity again to speak to you and, of course, to the population of St. Martin. My name, as you already said, is Ashley Duits. I'm a medical immunologist by training. That means that I know something about your immune system. I know something about viruses. I know about infectious diseases. Daily, I'm the director of the Red Cross Blood Bank in Curaçao, and I have a chair in medical education at the University of Groningen. Next to that, and from my experience, I've also worked on vaccines. So putting that all together, I have some views of importance on vaccines and how these things developed. And in that sense, advising our local government. And I'm very happy to also support the program in St. Martin.
Great. I know that there's been, of course, a very high spike in Curaçao recently, which has gotten under control. And we saw then that also the vaccination rollout increased steadily. How is the vaccination rollout going in Curaçao, where you are stationed? And what percentage of the population is now fully vaccinated, as let's say, and then segue into our situation right here?
Right. Well, we had our challenges, as you already mentioned, big challenges, as mostly every country has had. We had a vaccination program that's running well. We've reached about, let's say, 46% of coverage, of full coverage at this moment in time. And as most countries, you have a very strong start going up until the plateau we've reached at this moment in time. So we see our figures each week going down for vaccinations, but that's normal. That's the way the whole procedure works, because at a certain moment in time, you're facing the critics, you're facing people who not at first are very enthusiastic. So at this moment in time, we are at that part of our program. We are now going into the neighborhoods, discussing things with people, trying to be talking to them at their own frequency. So understanding what the issues are they have, discussing this also, for instance, with undocumented persons who at first are very hesitant to come in because of the fact that for them, there's another risk they see if they come and get vaccinated, what's going to happen to them. So addressing all of those things on a more personal basis, that's what we're working on right now. And it's going well, I need to say. The same holds true, actually, and was very glad to be in St. Martin last week. The same holds true, actually, for St. Martin. I've seen at front what's happening and how your team and the team of Mrs. De Wever is doing. And I need to tell you, I'm very impressed. I was even at a pop-up program in Old Dutch Quarter on Saturday. Again, very impressed. We tend to forget that what we are going through, this pandemic, is something extremely unique. The whole world is facing something new. So there is actually no guideline in saying, you know what, okay, you reach your plateau, so go to page 28 of your guideline and take these measures. I mean, we all know that doesn't exist. So it's very important for us to realize two things. The approach of a pandemic is actually a 1-2 punch. So at the one hand side, you're doing your public health measures. You need to have those in place. You need to have a strong team. And next to that, I would call it a knockout punch, but depending on how strong you are, you have your vaccine program. So those two you need to combine in order to face the problems you have with the pandemic. And I think we need to realize that the whole world is facing this same problem. So it's not only St. Martin, it's not only Curaçao, it's the Netherlands, it's the United States, it's now England, again, facing a couple of challenges. And if you want to put it into perspective, I looked up a couple of figures because St. Martin is more about 40% coverage, I think, at this moment in time.
We have 44 now. 44.
Yeah, so that's extremely well. I mean, if you look at Trinidad and Tobago, at this moment in time, today, there's 0.17% coverage. If you're looking at Barbados, it's 22%. If you're looking at St. Lucia, it's 11%. If you're looking at Brazil, it's 11%. So again, we're facing a lot of challenges. We need to realize how to approach this. And I think those two aspects are very, very important. So we have the vaccines, we have public health measures, and we need to combine them, but still we need to venture to higher levels of vaccination. Because also, as recently published in a couple of scientific papers, we know that elimination is much better than mitigation for reaching an open economy, for financing, and for healthcare. So trying to become as highly as possible percentage of vaccination is still extremely important. So again, putting that all into perspective, everybody is doing their best. I'm very impressed. Also in Curacao and certainly also in St. Martin. And we need to keep on pushing for getting that vaccination in. But next to that, we have to be realistic. And again, we need to go and talk to people and understand what they're saying. And again, such a program as you're making right now, I think is extremely important. But it's also important for people to realize that this is not because of the fact that we want to do something deleterious to the health of the persons on something else. We are investing a lot in helping. And if there are any questions, please talk to your GPs or call up the department and ask your questions, because that's why we're here.
Definitely, Dr. Deitz. I think you've definitely said a mouthful where that is concerned. And I appreciate that coming from you as a professional in the field. We are indeed very happy with our jump in vaccinated numbers. Initially, when we were at like 23%, it was being told by us, even within the kingdom, your numbers are too low, et cetera, et cetera. And we have actually been limited based on kingdom agreements also in how to execute the vaccination rollout. We had been asking for a long time to be able to go out into the communities because we knew that that was a deterrent for many of our people. And we're seeing that since we started the pop-up programs, that every weekend there's more and more people that come out to these pop-ups in their communities. We arrange for busing. And so we're doing that, as you said, alongside ensuring that the public health protocols are being strictly adhered to in the public places. But the reality of this new strain, Dr. Deitz, we've had a couple of little, incidences where it went up. When it went up strongly in Curacao, we were very much holding our hearts because we definitely couldn't afford that. But even when our numbers went up a little bit, our hospitalizations and deaths remained very low. Lately, however, we're seeing more and more people in hospital, and that is a big concern for us. So even though the numbers went up, they're on their way down. Vaccination rates are rising. The vulnerable people are ending up these days in hospital based on the level of the strains, I'm being told, but also because a lot of people are ignoring symptoms almost before it's too late. What can you tell the general public about that?
Well, it's a challenge, again, as I said, faced by the whole world. We are seeing what we call variants of concern. So those are mutations in the virus, and nowadays they have new names by the WHO. So they're called alpha, beta, alpha being the British variant, beta the South African variant, the delta being the Brazilian, and the gamma, the delta being the Indian, and the gamma being the Brazilian variant. What we know of them is, especially the latest ones, they're very infective. They're 50% more infective than the original one from Wuhan. So you would expect more persons to be infected. And what we're seeing, of course, because of the fact that we've tried to protect the ones that are most vulnerable, so the ones of a higher age, we are seeing now, especially two things. We're seeing younger persons coming into hospitals having complications because of two things we need to realize. First of all, the strains are more infective. So that's one. So for instance, the alpha strain is, of course, more infective than the original one. But now the delta chain, the Indian chain, is even more infective than the British variant. And next to that, we need to realize also that especially the young people, are getting public health measures wary. So they the strict adherence to the public health measures are again becoming more difficult, and that means that human behavior is of course changing. That's something else we also realize with this pandemic. It's not only about viruses and immunology and virology and knowing all of that and making your vaccines. It has a lot to do with how people manage. It's with human behavior, as with everything. So we need to understand that as much as we can. And that's a very difficult challenge. So going back to your original questions, the hospitals are getting burdened again because of this. So there are two things. It's the new strain, but we need also to realize that human behavior is changing and people are getting wary. Nevertheless, it's still very important to keep up with those measures because that's the only way out. And I can just give you an example of what happened now in Curacao yesterday. We were very happy to get our first tourists in with the cruise ship. But within that, we now heard that 2 people were infected on that cruise ship. So it's not only on that cruise ship. You can imagine if a lot of those people come on the island and walk around. Again, those public health measures are still of importance. This only serves to show you that as an island on tourism, you're very vulnerable. And so need to keep that. I always tell them, 1-2 punch, vaccine, public health measures, and try to convince everybody to keep that guard up until you are at a high enough percentage to have your herd immunity, which in all sincerity, we haven't reached yet. So we need to take those into account. The economy is opening up. It has to open up, but it cannot open up only with vaccination at this moment. So we need to rely on those public health measures also to, in a balanced way, treat and approach the situation we're facing. That, again, is something extremely unique. We haven't faced this in any way in our recent future.
Thank you so much, Dr. Duitz. We're coming up soon on our halfway break, and I really wanted to ensure that you got all that out. It's very, very important because a lot of us are experiencing the fatigue with the protocols, but I have been to the Netherlands recently and I'm seeing, like, for instance, in the open air, there's absolutely no mask wearing. When you get inside of public offices, they remove their masks, and I'm in shock because in St. Martin, once you're indoors, once you're in close quarters, you have to wear your mask. We do have, if the whole room is vaccinated, then we remove our mask. But other than that, we maintain strict mask usage and hand sanitization, etc. So we'll be right back after this short break, and then we'll go into some of the secondary impacts that people are experiencing as a result of COVID. Stay tuned.
Prime Minister Talks with Honorable Prime Minister Sylveria Jacobs.
Safely riding the school bus amidst COVID-19. Make your school bus ride to and from school a safe and enjoyable one. While waiting at the bus stop, please maintain a social distance of at least 2 meters. Always wear your mask at the bus stop and while traveling on the school bus. Board and disembark the school bus one at a time. Give each other space and time to enter. Sit at the designated seats assigned by the bus driver. Family members from the same household should sit together in the bus. Remember, your safety is important to us. A safe bus saves lives. This message was brought to you by the Ministry of ECYS in collaboration with the Ministry of TIAT.
Community Development, Family and Humanitarian Affairs under the Ministry of Public Health, Social Development and Labor proudly presents a Father's Day panel discussion on fatherhood in the 21st century. What does it take to be a father in this modern world? Tune in on Father's Day, Sunday, June 20th at 8 p.m. to St. Martin Gov Radio 1079 or view on the government Facebook page and the CDFHA Facebook page at 8 p.m. Fatherhood in the 21st Century panel discussion. Don't miss it.
All persons, even those who have received a COVID-19 vaccine, must continue to maintain physical distance, wear a mask to protect themselves and their communities, and thoroughly wash their hands. Patience is key and commitment is essential. The ability to keep each other safe and healthy is literally in our hands.
Hi, I took the vaccine.
Ik ben gevaccineerd.
I took the vaccine.
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 I took the vaccine. Me vacuné. Vacúnate.
I took the vaccine.
Oui, j'ai pris le vaccin.
I took the vaccine.
Moi prends un vaccin. I took the vaccine.
Be part of the solution. I will do my part.
Prime Minister Talks with Honorable Prime Minister Sylveria Jacobs.
Welcome back to Prime Minister Talks. We're having, of course, our season 2, episode 8 with Dr. Ashley Duits, stationed in Curacao. He already gave his great introduction, so you should know who he is. And if you missed it, you can always go back to the beginning. But I would like to say that we've been having a very interesting conversation, even off camera. Dr. Duits, we have been experiencing, as I said before, a higher rate now of hospitalization and again, death as a result of COVID, people having to go on ventilators, etc. But in our discussion, you also mentioned that there are people with secondary impacts even after they've recovered from COVID, or even if they were asymptomatic as a result of COVID. Can you please highlight some of these serious health concerns?
Of course. There's are things we are learning right now. As you can remember, this virus, we only know it for a year and a half. So now from science and data, we're learning a lot. We're now learning that in 10 to 15% of persons that have been infected, so not only persons with sequelae leading into a hospital or having complications, but also asymptomatic, about 10%, even after 6 months, have still some complications of the infection, either be it pulmonary problems, so they can't breathe right, they still have aches, they still have headaches, they still have a loss of smell, they still have a foggy mind, they have neurological or psychological problems, they can have kidney problems, they can have heart problems. So again, if you're looking at the risks to take and you're evaluating taking the vaccine, do not only focus on the, I would call them the short-term COVID complications you're seeing. There are other complications that you also need to put into perspective, because those are also COVID related, and even after 6 months. So in order for you to have your own risk assessment, please take those into account, because that's also going to be a burden, not only for you as an individual person, but it's also going to be a burden for the community, because you need to treat those patients. And we see already in the United States, very special centers are being used now for long-term COVID. So that's something to take into account, definitely.
Well, that's definitely something I really hadn't studied, but I do know of a couple of persons who were infected here on St. Martin who developed serious kidney problems, now have to do regular dialysis, and even persons who recovered from COVID, so there was no more trace of COVID in their bodies when they actually passed away. And that is because the COVID deteriorated, whether it was their hearts or their breathing systems or their kidney systems or all of the above, as you may have mentioned. So I really would like to encourage the people of St. Martin not only to look at, as you mentioned, the short-term effects of COVID, but the longer-term effects on the general health of our population. And especially even, as you mentioned, persons that even may have been asymptomatic. That is for me an eye-opener. And with that, I would go into the next question related to now the trend being that persons who have been infected before can now only required or suggested to take one Pfizer vaccine. Can you give us a little more, from an immunologist point of view, how this works and to put
it's a very logical approach. If you want to be completely protected, this is what we know now from science and literature and all data that has come in recently. you need to see the virus twice. Then when you see the virus twice, you're actually completely protected. So what does that mean? That means that you either have been infected, so seen the virus one time already, and then you get your first vaccine shot, which simulates an infection, you're seeing the virus for the second time, which is the same as getting 2 shots without having been infected. So that's the simple equation. We have looked at that very extensively. We see that all protective parts of your immune system are at par at the same level. So either being once infected and having 1 shot, you have the same amounts of protective antibodies, cellular protection in each and every way. So there's actually no big difference. In that case, that's why we're saying that's also, for instance, in the Netherlands now, the policy, and in developed countries, they say, you know what, you don't need to get that second shot because you've seen the virus twice. Your immune system is as high as it can get, because next to that, studies also show that even if you get that second shot and you have been infected, there's no extra push your body is getting. So what is very important to realize, so not only that is important, but also extremely important to realize there's something else. You need to get a shot even if you've been infected, because that's something else I've heard. People say, you know what, I went through the infection, I'm okay, I'm strong, I'm young, I don't need a vaccine. The same equation holds true for those persons. So if you had the COVID-19, you only seen the virus once. You need to get your vaccination in order to have a protection. And also need to mention that studies have shown us, especially studies in England now have shown us, that if you are not completely protected, you will not be protected against the variants, especially against the Delta variant. So even if you have seen the virus once and have been infected, if the new variants come in, you're not protected. That means, and what we see now is that persons who have been infected and have the Pfizer vaccine, they're protected even against the Delta variant, which is the Indian variant, and also the ones that have been normally vaccinated. So from all perspectives, all dimensions, all data we're gathering, please see, I would say that please see the virus twice. So that means either 1 infection and 1 vaccination, or 2 vaccinations in due time. And as I would say, you're ready to go.
That is, I think, very, very clear. I speak to people every day, even on the streets, passing from in and out of the building, going to work. And I ask people, I know it's a private thing for a lot of people, but somebody sent me a message today that's very poignant. If we remain that it's your private right to know whether you are vaccinated or not, then I'm running the risk as a vaccinated person to be around people who are, for the most part, not vaccinated. And for me, seeing the effects it has on families makes it, for me, imperative that we reach herd immunity. And we have to be realistic. We have a drive. We want to get to 85%. We don't expect we will get there prior to the end of July when our mass campaign ends. But of course, vaccinations will remain available. Can you tell us a little bit from your perspective again about the various types of vaccinations that are out there and to clear the people's minds in terms of their efficacy?
Well, we have at this moment in time, depending on where you live, we have a couple of vaccines approved. The United States has 3 of them approved. The Netherlands has 4 of them approved. There are other vaccines coming now from China and from Russia, for instance. And even Cuba is developing their own vaccine. But from the ones we have, like the Pfizer and Moderna, are extremely well. They have a protection of about 95%. The Johnson & Johnson has a little bit lower coverage of around 70%, which is, let me remind you, normally looking at vaccines, all other vaccines, if we have a vaccine that gives a coverage of 70%, we go as vaccinologists and immunologists, we go, wow, this is a tremendous vaccine. This is something we want. We have the luxury of having other vaccines available now, even in St. Martin, that have a higher coverage, which is unseen actually, historically wise. But let me just say that all of those vaccines that have been approved in the Netherlands, especially the Moderna, the Pfizer, and even the Johnson & Johnson, are very good vaccines. You can use them. They're very protective. And the challenge, of course, is getting those vaccines in your country as early as possible and getting yourself vaccinated as early as possible. But from a scientific and an effectivity point of view, they're all good vaccines. As we've known, a couple of the Johnson & Johnson and AstraZeneca have some complications described, but in a very low frequency. So thrombosis, for instance, or other aspects, 1 in every 300 or 400,000 people. That means if you're going to vaccinate the whole St. Maarten, you would vaccinate St. Maarten 4 or 5 times over without seeing any of these complications. So in a general sense, make use of anything you can get that has been approved, and that's the chances are much higher for all other COVID-19 complications than having a complication of one of those vaccines. And for the ones of Pfizer and Moderna, we know, for instance, that there is a complication if you are allergic to a certain component, which we call PEG, polyethylene glycol, and that's 1 in every 250,000 persons, or etc. So that's why when you get your vaccine, we have an observation of 15 minutes. You will see that in St. Maarten. Also, there are doctors present just to see if you can get that complication. There are drugs that you can get immediately, and then the problem will be resolved. But again, the risk of getting that is extremely, extremely low, which doesn't weigh in any way to the complications of getting infected with SARS-CoV-2.
Exactly. And I think that is exactly what I want us to end with. We have just under 2 minutes, and I really want you, I'm not going to say anything further. Why is it important for us to be vaccinated? You have about 40 seconds.
Here we go. All right. I think we've mentioned it a little bit again. It's about a lot of things. It's a lot about your health, about the health of all the persons you love. It's about your responsibility for your community. It's about your own work. It's about anything that you want to do in the future, because maybe your choices, you do your choice yourself, but the world around you is changing. So those requirements for your financing, for your economy, and for your health, it's a no-brainer. Take the vaccine. You are in a very privileged position at this moment in time. Look around you. Other countries don't even have a vaccine. So I would completely support and recommend you to do that. The government of St. Maarten is doing an excellent job. You have the facility. You have the pop-ups. Please go and get vaccinated.
Thank you so much, Dr. Duits. It has been a pleasure speaking to you. We could have gone on for much, much longer. I know that the people of St. Maarten, maybe you're going to become a household name where COVID-19 is concerned, for sure. I want to wish the people of St. Maarten much strength, much safety over this weekend. And as we move forward, we will continue to exercise very strong healthcare protocols within our society so that we can remain open. But it all depends on human behavior. How we behave, how we act will preserve our health and the ones that we love and keep our economy open. We want to be able to get back to normal, and by getting the vaccination, we will get there faster. So until then, stay safe, get vaccinated, and we are going to celebrate Flag Day as well. So make sure you celebrate St. Maarten Flag Day safely. Have a wonderful day. Bye-bye.